So this topic is on a slightly different kind of topic, which is the adolescent breast. But nevertheless, it is extremely important that we get to know about the adolescent breast. Adolescence is a transformative period marked by significant physical, emotional, and social changes. For young individuals, breast development is a critical aspect of pubertal growth. Not only is the physical development important, but psychosocial changes associated with breast development can lead to being ridiculed, depression, social withdrawal, lack of self confidence, low self esteem, and even fear of breast cancer. So, as a gynecologist, the onus lies on us to counsel the young girls and remove their misconceptions and myths, tell them about the facts, and even go ahead with examination if required. Before we start with the disorders, let's just go quickly through the Tanner staging of the breast development. At the age of 8 and below the age of 8, the chest remains flat. At the age of 8.5 until 11 years, the breast bud stage with elevation of breast and papilla starts. And this is stage 2 Tanner. Stage 3, there is further enlargement of the breast and areola. Stage 4, areola and papilla form a secondary mound over the level of breast. And at stage 5, which occurs around the age of 15, there is a mature stage where the projection of papilla is there, but there is a recession of the areola. The important thing to note in the Tanner staging is that 8 years and less, if there is thelarchy, that is, if there is breast development, it means that it forms an important part of precocious puberty. And if there is no development of the breast till age 13, that could mean that the patient is going into delayed puberty. So what are the breast concerns in the adolescent females? Let's have a look. There could be a congenital or a developmental condition, infections, fibrocystic disease, nipple discharge, pain, benign breast masses, that is, especially the fibroadenoma, is the commonest disorder found in the adolescent breast, and sometimes, but importantly, the malignancy. So what are the congenital conditions? There could be athelia, which is absence of nipples, amastia, which means complete lack of breast tissue, polymastia, which is presence of accessory breast tissue usually found in the axilla. And this is something which we do come across in our clinical practice, especially during lactation of the patient. The importance of polymastia is that this tissue can undergo the same pathological problems as the normal breast, and surgical removal can be discussed for not only for cosmesis, but also for prevention of pathology that may develop there. And what is polythelia? Polythelia is presence of a number of nipples along the milky line. What about the congenital disorders of the nipples? The most common is inverted nipple. It is a normal variation, but yes, it can lead to inflammation and even abscess sometimes. Coming to the developmental conditions, well, there could be breast asymmetry, where only reassurance is required, or a use of a padded bra for the smaller breast. There could be a breast hypoplasia, which is due to decreased estrogen secretion. But yes, causes which should be excluded are Turner syndrome, androgenic tumors, pre-adolescent hypothyroidism, and pituitary hypogonadism. Then there is juvenile breast hypertrophy, which is considered as a result of high sensitivity to estrogen receptors. Tuberous breast, very abnormal development. The base of the breast is totally underdeveloped, and the nipple and the areola are overdeveloped. Surgical correction helps in improving the look and the self-esteem and, of course, breast function. So what can I offer as a gynecologist? Well, catch them young when they come with a complaint, with any complaint. So talk about lifestyle, healthy lifestyle. Make her breast aware. Counsel her. So teach her self-breast examination and also pick up the high-risk cases. What is breast self-awareness these days? These words are doing the round. rounds. So it involves the girl understanding the normal appearance and feel of her breasts without a specific examination technique so that she can promptly report any changes to the doctor. Breast education improves adolescent girls' breast knowledge. It improves her knowledge, her attitude towards the breast, and it helps inculcate positive breast habits. Well, we will be discussing four cases which are commonly seen amongst the adolescents. So, coming to our first case, which is the case of the mouse in the breast, the fibroadenoma. A 17-year-old girl comes accompanied by her mother, both looking scared and concerned about a lump in the breast, which the girl noticed 2 days back. So, on examination, it's a painless, unilateral, well rounded, mobile lump, and our guess is the fibroadenoma, which is the correct diagnosis. But yet, let's confirm it by ultrasound. Confirms the diagnosis, and it also helps us to plan the management because it gives us the correct measurement of the lump. And in case the lump is 2 centimeters above, we may even need to excise it. And we may even miss a few more lumps on examination, on clinical examination. So ultrasound tells us how many lumps there are. Mammography is not required. Triple assessment algorithm. This is my favorite slide. And whenever a patient comes with any breast complaint or disorder, the triple assessment algorithm should be put into action, which includes number one, the clinical assessment, that is the clinical breast examination, as well as the family history and a personal history. Number two is imaging. And in an adolescent girl, ultrasound is the preferred modality of imaging, and that is done only when required. And the third thing is the tissue diagnosis. If indicated, it should be a core biopsy. So triple test has protocolized the management of any breast problem, just like Gandhiji's three monkeys have protocolized our life mantras. What is the management of fibroadenoma in an adolescent girl? Well, it could be simply reassurance, and it may need no treatment in most cases. But what are the indications for surgery? Well, if the size is 2 centimeters or more, if there is a giant fibroadenoma or a complex fibroadenoma, or if there is a family history of cancer breast in a first degree relative, or on patient's request. So what are the techniques? Lumpectomy, excisional biopsy, cryoablation after a core needle biopsy. Very important. So let's just forget about the excisional biopsies and all. Come to the minimal invasive techniques. So the first one is VAB, which is vacuum-assisted breast biopsy. The advantage of a VAB is that it also gives us material to biopsy, and it removes the lump. It's an almost scarless surgery. Radio frequency ablation. This is non-invasive. High alternating current is passed to the tumor through an electrode, resulting in cell death. And then finally, HIFU, which is high intensity frequency ultrasound. This is highly focused ultrasound waves which interact with the targeted tissue, and the thermal energy thus produced results in tissue coagulative necrosis. The advantages of HIFU and RFA are that they are non-invasive and they leave no scar, which is so important for an adolescent. Coming to case 2, very commonly also seen in our practice is my breast is too small. A young girl is accompanied by her 18-year-old friend who, with hesitation, says she is concerned about her small breast. She has a number of questions for you. Are you ready? Well, what can I eat to increase their size? I see a lot of ads on the internet advertising lotions for breast massage to increase breast size. Which lotion should I use? Can I take some Ayurvedic medicine? Can I take hormones to make them bigger? How about breast implants? So, what do we say? What is the role of the doctor? Well, firstly, we must rule out congenital causes of micromastia, which could be Poland syndrome, most importantly for us, the Turner syndrome, or the congenital adrenal hyperplasia. Advise her on a healthy diet and exercise and weight gain. All these things will help her build her pectoral muscles, her chest muscles, and also The weight gain will help her increase the size of her breast tissue, help her build her self confidence, most importantly, and self esteem, because self esteem and self confidence are not totally dependent on the physical aspects of the body. This is what we need to tell her, and it is the inner self that she needs to build. Breast augmentation, the non surgical methods, well, wear a padded, gel filled bra, and of course, the surgical options, lastly, should be put forth. Size does matter. Overly large breasts can cause backache and neck pain and can attract undue tension. Again, diet, exercise, weight loss, and surgery finally, the surgery are the cornerstones of treatment. So, coming to our case 3, fibrocystic disease of the breast, which can cause nostalgia. Oh, it pains. Case 3. A 14-year-old girl comes with the complaints of bilateral breast pain. The pain comes for a few days every month. On asking, she tells that the pain is cyclic and premenstrual. Well, we take a relevant personal history of tea, coffee intake. Excessive tea, coffee intake can cause nostalgia. What about exercise? These days, the children are always studying or sitting down, watching their mobiles. They don't exercise, they don't get time, and their dietary habits are bad. Smoking, alcohol, trauma, we can talk about all this. And we can also talk about OC pills. Is she taking OC pills by any chance? And her family, and take her family history of cancer breast, ovary, colon, prostate, pancreas, and first degree relatives. On examination, in this case, we find bilateral breasts which are normal. There are no significant lumps. Small, mobile, tender, lumpy breasts are palpable. So, what is the management? If we want, we can do an ultrasound, but usually the diagnosis is obvious, and management of fibrocystic disease is simple. It is reassurance, reassurance, and reassurance, and counseling. These form the first line of treatment, and 85% satisfaction levels were seen with proper reassurance. Secondly, and importantly, mechanical support also forms part of the first line treatment. A well fitting brazier is advised. Now, for an adolescent to find a well fitting brazier is a challenge. Sports bras provide comfort and support, so they can also be advised. Help by preventing. What does the sports bra and a good fitting bra do? It prevents overstretching of the Cooper's ligament. Exercise is found to be beneficial, avoidance of caffeine, alcohol, smoking, marijuana. All these things can lead to uh, uh, avoidance of pain. So, what are the medications to be used? Ibuprofen is the drug of choice. Of course, we all give vitamin E and primrose oil, though it works to a large extent or certain extent, but these are not written in the books. Infections in the adolescents, the common infections we must know about are caused by obesity, by mammary duct ectasia, hidradenitis, nipple piercing, tuberculosis, and bruising. So coming to our last case, which is case 4. Can I have breast cancer? Well, a 45-year-old lady comes to you with her 18-year-old daughter. The mother has suffered from cancer breast at the age of 42 years. She wants to know what are the chances of her daughter having breast cancer and what can be done to prevent it. How will you guide her? Well, the question is how to pick adolescents at high risk for breast cancer. This is what we need to do first. So, any first degree relative, that is the mother mainly, or a sister with breast cancer, endometrial cancer, or colorectal cancer, does she have any such history? Does she have a history of multiple members of the family with breast cancer? Is there any first degree relative with breast cancer detected before the age of 50 years? Is there a first degree relative having BRCA mutation? Does the patient have ovarian cancer, which is of course there are very remote chances, but yet, and is there a male relative with breast cancer and an endometrial cancer and breast cancer diagnosed in the same individual? So these are the patients with such history who are at high risk for breast cancer. And these are the patients, either we get their BRCA mutation gene tested or or the index case or of the index case. Like for this particular case, it's the mother who needs to be tested for BRCA mutation. Now, if this patient falls into the high risk category because she comes from a BRCA family, then what do? We send her to the genetic counselor for counseling. We send her mother first, and if the daughter is ready to get counseled, then she's also counseled. Because we don't want to instill any fear factor in the little girl. So therefore, it is best to ask the mother if she wants her daughter to have the genetic counseling. So once we know that the patient is in a high risk category, what do? Breast self-assessment is done starting at the age of 18. Breast self-examination is started at the age of 18 and it's done monthly soon after the periods. What about clinical breast examination? These high-risk adolescent girls every 6 to 12 months from age 20. And mammography is also advised annually from the age of 30 in high-risk adolescents, and so is MRI annually from the age of 30. So very remotely we get these kind of cases, but we ought to know what to do with them. And what do we ask her to check on? We need to tell her that look for inflammation or rashes, that is, rashes on the breast skin when she's showering. Let her look at herself, at her breast in the mirror. Look for any rashes on the breast. Look for any lumps or swelling. And look for rashes or crusting around the nipple. Then is there any unusual discharge from the nipple? Is there a dimpling in the breast? And is there a change in the size or shape? Well, a word about breast cancer in adolescents. Primary breast cancer is extremely rare in childhood and adolescence. Incidence is 0.1 in 100,000 cases in young women between the ages of 15 and 19 years. Breast ultrasound is the examination of choice for evaluation of any breast mass in the adolescents. Mammography will be needed and MRI if in doubt or if when the patient falls into the high risk category for breast cancer. Core needle biopsy under ultrasound guidance should be done to clinch the diagnosis and to decide whether the status is ER/PR positive and to decide the line of management. Also, what about the lifestyle changes that we need to tell such a woman, such a girl? Well, there should be a sensitive and non-judgmental communication regarding nutrition and processed food. Everybody is eating processed food. Why should we blame the poor girl who comes to our clinic? So, therefore, it should be a very sensitive communication. Physical activities like dancing, Zumba, swimming, whatever she likes should be encouraged. Weight maintenance, proper sleep. Say no to smoking, alcohol. Reduce electromagnetic field. एक तरफ they have their laptop on the bed and on the other side their mobiles. So this electromagnetic field has to be reduced and decrease exposure to screen time, meditation. Well, what are the legal and ethical considerations? Very important in the days of medico-legal problems. Well, adolescence is known to be a time when individuals often engage in risky behavior. Immaturity can potentially impact and limit an adolescent's ability to make an informed decision about plastic surgery. Sometimes they come, oh, I want augmentation of the breast. Oh, I want reduction of the breast. Oh, I want nipple piercing, so on and so forth. So adolescents under the age of 18 are legally cannot give consent for surgery. Parents or legal guardians must provide consent. Cosmetic breast augmentation should be reserved for individuals 18 years of age and older. So lastly, the take-home messages are all breast disorders may occur in adolescence. As gynecologists, we must be aware about this aspect of the adolescent body and deal with issues that arise. Multidisciplinary approach is needed. Pediatrician, gynecologists, plastic surgeons, psychologists are required for the best management of breast disorders in the adolescent girls. Early diagnosis and treatment helps in the psychological, sexual, behavioral, and social skill development. Thank you very much for your patient hearing.